When referring to the left and right, it is in reference to the patient's directions. Right is our left, left is our right. Superior means toward the head. For example, the eyes are superior toward the nose. Inferior is away from the head. For example, the stomach is inferior to the mouth. Posterior means toward the back of the body. For example, the kidneys are posterior to the stomach. And then for anterior, it means toward the front of the body. So for example, the heart is anterior to the spine.
Medial means towards the midline, which is the imaginary line down the middle of the patient's body. For example, the tongue is medial to the eyes. Lateral means away from the midline. For example, the ears are lateral to the nose. Proximal means close to the origin of the body. The origin is where the limbs connect to the body. For example, the shoulder is proximal to the paws. Distal is further away from the origin of the body. For example, the paws are distal to the thigh.
Superficial means towards the surface of the body. For example, the muscles are superficial to the bones. Deep means away from the surface of the body. For example, the heart is deep to the fur.
The dorsal body cavity protects the nervous system, and it includes the cranial and vertebral cavity. The cranial cavity encases the brain, and it includes the brain and the skull. The vertebral cavity runs within the vertebral column and includes the spinal cord. The ventral body cavity contains the viscera, and it includes the thoracic and abdominopelvic cavities. The thoracic cavity is superior to the abdominopelvic cavity and includes the lungs and the heart. The abdominopelvic cavity contains abdominal organs and includes the stomach, intestines, spleen, liver, bladder, reproductive organs, and the rectum. The sagittal plane divides the body into left and right parts. The mid-sagittal plane is a sagittal plane that lies on the midline. The frontal plane divides the body into anterior and posterior parts. The transverse plane divides the body into superior and inferior parts. The right upper quadrant is the patient's right top abdominopelvic section, which appears as our left. The left upper quadrant is the patient's left top abdominopelvic section, which appears as our right. The right lower quadrant is the patient's right bottom abdominopelvic section, which appears as our left. The left lower quadrant is the patient's left bottom abdominopelvic section, which appears as our right. The right hypochondriac region is the patient's top right section, which we see as our left. The epigastric region is the patient's top center section. The left hypochondriac region is the patient's top left section, which we see as our right. The right lumbar region is the patient's middle right section, which we see as the left. The umbilical region is the patient's middle center section. The left lumbar region is the patient's middle left section, which appears to us as the right. The right iliac region is the patient's bottom right section, which we view as the left.